Hi, I'm Dr. Swati Kanakia, a pediatric hematologist oncologist from Mumbai. This video tells you about the when, where, how, and why of chemotherapy. So, what is chemotherapy? Chemotherapy is a type of treatment for cancer, like radiotherapy and surgery. Why do we give chemotherapy? Like everything in medicine, any kind of drug is given for a cure. So also with chemotherapy. The primary aim is to cure the patient. Sometimes it is used to relieve the symptoms. Sometimes when we feel that a cure is not possible, we might use it to control the growth of a tumor. It is used sometimes before a surgery. This is done to shrink the tumor to make it small so that surgery becomes easier and surgery becomes less complicated. This is called as neoadjuvant chemotherapy. Even after surgery, although everything has been kind of removed by the surgeon, we still advocate adjuvant chemotherapy so that whatever little is left behind or whatever microscopic disease is perhaps there is completely wiped off. How does a doctor decide which chemotherapy is to be given? There are so many drugs. So let me tell you that all treatment decisions are based on extensive research which is carried out all over the world. Standard guidelines are formed on using chemotherapy, and these are followed by all pediatric oncologists all over the world. And these treatment and these decisions are basically made on the type of cancer, on the stage of the cancer, overall health of the child. It depends upon the previous treatment that he or she has received, and sometimes we align our our decisions based on the child's and the family's goals and the family's preferences. The other question patients want to know is that, does my child need to be hospitalized throughout the whole chemotherapy or the whole treatment? Well, some of the drugs can be given at home if they're oral drugs. If it's a short chemo, it can be given on an OPD daycare chemotherapy unit basis. These are present in all hospitals. If sometimes the chemo is longer, it is more intensive, a longer admission may be required, and at that time you need to be admitted in the hospital for a couple of days. Mainly it is for hydration, that means giving saline or IV fluids before and after the chemotherapy. The next question is that, how often is chemotherapy given? So, this decision is based on the schedule of chemotherapy, and these are called as protocols. A protocol is decided based on the type of the cancer, on the stage of cancer, on the intent of treatment, whether it is a curative intent or a palliative intent, where we find that we cannot really cure the patient and we just are trying to control the disease. The other question which I frequently am asked is, how is chemotherapy given? So chemotherapy can be given by mouth, as in tablets. It can be given in the vein via a cannula or an IV line, like it's popularly called, by a port which is inserted in the anterior chest wall, and we kind of put in a needle there and give the medicine. And then there is a PICC line which remains in the arm of the child for a long time, and all medicines are given via the PICC line. And for a short duration, we may also consider a central line or a neck line. Chemo can also be given in the skin, that is the subcutaneous route. It can be given in the muscle, which is the intramuscular route, and it can be given intrathecally, that means in the space around the spinal cord, and this is typically given in those cancers which are known to spread to the central nervous system or are already present over there at the time of diagnosis. Patients are very keen on knowing what is a cycle of chemotherapy, because cycle is generally, we look at it as a bicycle. So what is a cycle of chemotherapy? So it is actually the duration of giving chemo plus a period of rest for the body to recover and rebuild. This is again followed by killing the cancer cells and then allowing normal healthy cells to recover. These cycles vary according to the protocol which we just discussed. A very, very important question is that, will my child have side effects? Well, yes, um, and no. All side effects will not happen in all patients. There will be some side effects, unfortunately, and this is because along with the cancer cells, normal cells are also killed, they're also injured, and this is what actually leads to side effects. So basically, in the process of killing the cancer cell, chemotherapy also injures and kills the normal cells, and therefore it is like an innocent bystander which gets injured in this whole process. So the side effects are nausea, vomiting, loss of appetite, hair loss, mucositis, which means there is a burning sensation or pain and ulcers in the mouth. The skin and nails can also get affected. The skin may become dry, the nails become brittle, they sometimes get discolored and black. There are problems in thinking, in memory, in attention, and some drugs cause diarrhea, and some chemotherapy agents give rise to constipation. These are known as the acute side effects, or those that occur during the chemotherapy or immediately after it. The other very important side effect are decreased blood counts. So there could be low WBC counts giving rise to infections, a low platelet count which can cause bleeding, easy bruising, nose bleeds, bleeding in the stools, bleeding gums. You could also have low hemoglobin, which makes the child very tired. They get breathless. They may have palpitations, and your doctor will, of course, guide you through the side effects that the child is likely to have. But the good news, my friends, is that it's a very temporary side effect, and this is definitely going to pass. So just hang on, and the child should be fine. Also, that we have so many good medicines that look after most of these side effects. Unfortunately, there are some side effects which are delayed, and it's very difficult, um, uh, you know, to control these side effects. However, protocols all over the world are trying to bring down the doses. They are also trying to add more drugs so that the amount of a particular drug is not very high, and therefore the side effects are lesser, and yet you get a good kill. We also do something called as risk stratification, where at the beginning of chemotherapy, we determine how aggressive is this disease and how much chemotherapy is this child likely to need. So in those aggressive tumors, we are as aggressive as well. And in those tumors which are not very aggressive, we tend to give lesser chemotherapy. So this is called as risk adaptation. Excuse me. Nevertheless, some of the later side effects that can occur are damage to the lung, heart problems, hearing problems, infertility, kidney problems, nerve damage, and the risk of second cancers. I hope you find this video useful. If you know somebody who will benefit from this video, please do forward it to them. Thanks a lot for watching. I must tell you all that this video is not a substitute for your doctor. And please, at all times, follow the guidelines which are issued by your oncology unit. Thank you.